Hi, welcome to the Knee Pain Coach program. This first one we're going to do the understanding of the knee. So we have our skeleton guy here. One side is going to show ligaments, one with the blue and red is going to show where the muscles attach. The one thing to know about the knee, and it's just an obvious statement, it is stuck between the hip joint and the ankle joint. That's important because whatever the hip and the ankle does or doesn't do, it's going to influence the knee. So obviously it's an anatomical position, and that's why the knee is susceptible to a lot of injuries, because we get top-down influences from the hip, pelvic muscles, and twisting and running. We also get bottom-up influences of how it can affect the knee from how if you're flat-footed, that can affect knee problems. If you have an internally rotated hip or you're born more toed out or hip out, that's going to influence what happens to the knee. A common thing is arthritis, and that's when this meniscus, so you have what's called the medial and lateral meniscus, basically what a lot of people refer to the inside or the outer meniscus of the knee. So this is just how the knee bends. When you open it up, you can see the meniscus. It's like shock absorbers. So without that, and when that wears down, people get arthritis, and that can cause pain. But not always. Sometimes you can have arthritis without pain. The one thing to know about the knee is it does flex and extend, or bend and straighten. That's how it's typically thought of. So we can straighten 0 degrees. If someone has -10 or more of hyperextension, that is a bad thing, or can be a bad thing. It puts the person more at risk for tearing their ACL. We should be able to bend at least 120 degrees. Some people can get 150. I've measured 160 in a few small occurrences. So basically between 0 and about 150 degrees, the knee bends in this plane of motion. The other 2 planes of motion that the knee moves in are rotation, which some people can have 10 to 20 degrees of total rotation, either coming from their upper leg bone, the femur, or their lower leg bones, tibia and fibula. The third plane of motion that the knee moves in, but not a whole lot, is side-to-side movement. That's usually shown when someone is standing and they're moving or pivoting their hips side to side. The knee will adjust based on what the hip and the ankle tells it to do, and it will have a little side-to-side motion. What happens in some extreme cases, and you've probably seen this, you might even experience this yourself, if you're in what's called a varus, that's a fancy word for bow-leggedness, you're going to put, and you can see here, you're going to put more force on the inside part of that meniscus. So if you're like this a lot, and then you do a lot of motion and walking and squatting throughout your life, you're going to wear down that inside. I think it's stated about 90% of people, they'll wear down the inside or medial part of their knee, and that's where they get a lot of arthritis, which leads to knee replacements, which they're doing well over 750,000, closing in on 1 million per year in the United States alone, just with knee replacements. And a majority of them are because this inside part was worn down. Now the opposite of that is what's called valgus, and you might have seen people like this, where their knee actually caves in. So that can be, the less technical term would be knock-kneed. So if you have 2 valgus, you're going to be kind of knock-kneed, and then the other way would be more bow-legged. And you can see with that one, I'll just move this knee patellar ligament out of the way. With that, you're going to wear out the outside part of the meniscus more so than if you're bow-legged, where you wear out the inside part. A few other things. This is a big, thick tendon, ligament, patellar ligament. Behind there is your kneecap. So that should glide and move in all 3 planes of motion as well, very smoothly, which allows you to kick and run and walk, squat, sit, stand, pivot. The most popular ligament most people hear about is the ACL. It stands for anterior cruciate ligament. Cruciate stands for cross. A good way to remember that is if it's your right hand or left hand, you just cross your middle finger over your index finger. the middle finger would represent your ACL. The index finger would represent the PCL, which is the posterior cruciate ligament. And I'll just kind of twist this guy around. And that's located on the back. And you can almost see there that it is like a cross, or cruciate. That's where it gets its name. Then you have the medial ligament, medial MCL and LCL, which you might have heard a lot of football players, basketball, soccer, they'll tear those or strain those. So we've talked about the knee. It moves in 3 planes of motion. It's dictated by what happens at the hip and ankle. It can develop arthritis and ACL injuries, even meniscus injuries. And one last fact, there are 4 muscles that attach to the kneecap, patella, and there are 22 muscles that attach to this femur bone. So when we do a lot of rehab, which we'll show in follow-up videos, we tend to put a lot of emphasis on the 22 muscles versus the 4. We still work the 4, but the 22, because of the sheer number and the volume, I mean that's 5 times as many muscles, we want to make sure that's strong. That'll be protective of the knee. So there's understanding the knee.